Hi, this is Kathy for Trans by Deaf, and this week we have been asked by Harley to talk about the gatekeepers that we have in our transition. And she specifically asked us to talk about the gatekeeper of hormones and the gatekeeper of surgery letters. I am not sure that these are as big of gatekeeper as some people think they are. In my transition, when I realized that I needed some help and went to my psychologist, I went and visited with her for about 3 to 6 months to the same psychologist, and then I looked at her one day and said, I would really like to develop a feminine body. And she said, it is time for you to go and take hormones. And she said, I will be happy to write you a letter to get those hormones. And I would recommend that you go to the doctor that I typically use, and I will call him and make an appointment for you. And she did that. And I went and saw that doctor and got those hormones and started to take them. And I have had very good success with it. He has, for the entire time, monitored my progress and monitored the effects of the hormones on my body. Every 6 months, I have to have a blood test, or do have a blood test, to determine if I'm on the right dosage of estrogen and the right dosage of testosterone and where I stand. And I have been very happy with the process that I went through. And I guess if I had to say, I'm very happy in the way in which I handled the process of that particular gatekeeper. Now to talk about the second gatekeeper that Harley asked us to discuss, and that's the gatekeeper of surgery letters. Well, I have been seeing the same psychologist and the same doctor now for over 4 years, and I have been full-time for about 3, maybe a little bit more, and on several occasions over the last 2 years, my psychologist has said, well, what are you going to do about surgery? And I also visited with my family physician and with my endocrinologist, the same endocrinologist that gave me the hormones. And he and my family physician both feel that the recovery time would be extremely long for me to have SRS or GRS. But they said we would let you have, we would sign the letter necessary to get you to have sexual reassignment surgery. However, we strongly recommend that you don't have it. I also have the input from the religious people that I'm around, and they strongly recommend that I don't have the SRS or sexual reassignment surgery. And so the people who are around me are saying that's not wise, at least at this time. So I have not had that. However, when you look at what the doctor told me and what my psychologist and some of the other psychologists that I've talked to have said, I would have no problem at this point in time, having been full-time for about 3 years, getting those letters that were necessary to go and have SRS. The decision is in my court as to whether I want to have SRS or whether I don't. At this point, I have chosen not to, because I do not like what the doctors are telling me about the long recovery time. But that is my decision, and I don't feel that I have had any argument with my doctors or my psychologists or the people who have been helping me through this transition. Now, to kind of conclude this thing, what I would like to say about the gatekeepers, if you go through and you start with a normal path of seeing a psychologist, that psychologist will probably want to see you for about 3 months, maybe more. In my case, it was 6 months or nearly 6 months. And then it is appropriate to ask, do you think I am ready for hormones? I think I'm ready for hormones. Will you recommend them? After you've been full-time for about a year, it is then appropriate to approach that doctor about a letter and approach your psychologist about a letter of recommendation to get SRS. I don't see that there's any problem in doing that. If you go and follow the rules that are out there, and really these guidelines are set out by WPATH as to how long you need to wait, and I think from my perspective they are very wise rules. It just so happens that on the second Gatekeeper I've decided that I don't want to go that way at this point. I may change my mind later, or my health may be to the point where I can do that, but I have not taken that step, and I may never take that step. There are a number of transgender girls who never ask for that letter for reassignment surgery. So, to me, what you have to have is the patience to go through the recommendations made by the World Health Organization, or WPATH, and talk to the people that are necessary, because I would find it very difficult for me to go through such a complex and such a complicated decision as hormones or SRS without time to think about it, without the recommendations of my doctor, my psychologist, and the other people that work with me, the people that know me. And I've also discussed it with my wife and some of the people who I'm associated with the church. Well, those are my comments for today. Thank you again for joining me. If you have some comments, please leave them in the space below. I will always answer them. And you have a good day. We will see you next week. Bye.